Has said that it is facing the worst crisis scenario for this time of the year, as cases spiked by 55% in a week, taking the total number of hospitalized patients to an average of 2,660 each day last week. UK's health minister has also said that the numbers could triple before they peak, adding that the situation in hospitals across the country is already inexcusable. Now, as the number of cases continue to rise, the health minister has also urged doctors to call off the planned 5-day strike. In an article in the Times, the minister has appealed to resident doctors to accept the government's offer. The health minister has also agreed to doctors' union demands that UK-trained physicians get priority for training posts over candidates from abroad. Furthermore, UK Prime Minister Keir Starmer, in an article on The Guardian, said that the resident doctor strike should not happen. He has called the planned strike as reckless, while adding that the strikes place the NHS and patients in grave danger. Prime Minister Starmer has also asked the doctors to take the good deal that is there on the table. While UK is grappling with the super flu, Pakistan is also seeing a sharp rise in super flu cases. Senior medical experts are reporting a sharp rise in super flu cases at densely populated urban centres in Lahore. Doctors say that no deaths have been reported so far, but the number of patients presenting with flu and chest complications have risen.
The number of nurses leaving the profession in England has hit a record high, according to new analysis by the Nuffield Trust. More than 40,000 qualified nurses left NHS employment. That's 11.5% of the total.
61 emergency zones downgraded in 24 hours. 5,700 life or death calls rerouted. Response times in some regions stretched to nearly triple the national target. That is the state of Britain's emergency system this week. A system that didn't crack, it buckled. For months, ambulance crews have warned that rising violence linked to illegal migration hotspots and neighborhood flashpoints has turned routine call-outs into high-risk operations. Not isolated incidents, not rare confrontations, a pattern, spreading, hardening, escalating. And now, for the first time, the consequences are happening in plain sight. Across England,
right now, the United Kingdom is facing a moment that many experts say goes far beyond healthcare. Reports of a mass paramedic walkout affecting dozens of coverage zones have sent shockwaves through emergency services, but the real concern runs deeper. When the front line of emergency response begins to strain, it exposes cracks in the wider system: financial, political, and economic. And tonight, we're breaking down what this moment means, why it's happening, and why economists say it could be a warning sign for the UK economy itself. According to initial reports, a significant number of paramedics have stepped away from duties as part of industrial action, immediately affecting emergency coverage across numerous zones. Authorities stress that contingency measures are in place to protect life-critical cases, but the disruption is real. Response times are under pressure, coordination is stretched, and the public is being advised to use services carefully. The question many are asking is simple: how did it come to this? To understand the walkout, you have to understand the pressures paramedics have been under for years. Rising call volumes, chronic understaffing, long shifts, and emotional burnout have become the norm. Add to that pay disputes, inflation-driven cost of living pressures, and limited funding increases, and you get a workforce that feels pushed to the edge. This walkout, paramedic leaders say, is not about a single issue, it's about sustainability. But here's where the story widens. Healthcare does not exist in isolation. When emergency services are strained, the economic effects ripple outward. Businesses lose productivity as workers deal with delays and uncertainty. Local authorities incur extra costs for emergency planning. Hospitals face bottlenecks that increase spending without increasing outcomes. And public confidence, an often overlooked economic driver, takes a hit. Economists have long warned that public sector strain can be an early indicator of broader economic trouble. When wages fail to keep pace with inflation, when funding models lag behind demand, and when recruitment can't keep up with retirements, services begin to falter. The paramedic walkout is being watched closely because it sits at the intersection of labor markets, public finance, and productivity. Consider the labor market. Paramedics are highly trained professionals. When large numbers are absent, even temporarily, it reveals a shortage that money alone can't quickly fix. Training pipelines take years. Retention matters more than recruitment. And when skilled workers feel compelled to walk out, it sends a signal to other sectors facing similar pressures. That signal can spread. Now look at public finances. Emergency healthcare is expensive, but delays are often more expensive. Missed response times can lead to worse outcomes, longer hospital stays, and higher long-term costs. During periods of industrial action, governments often spend more on temporary measures than they would have on negotiated settlements. Over time, this creates a cycle of reactive spending that strains budgets already under pressure. There's also the productivity angle. The UK has struggled with productivity growth for years. Health-related work absences are a major factor. When emergency services are disrupted, minor incidents can become major ones, keeping people off work longer. Multiply that across regions and weeks, and the economic impact adds up. Public confidence is another key piece. Markets respond not just to data, but to perception. Images of strained ambulances and warnings about emergency coverage can affect tourism, investment sentiment, and consumer behavior. People delay spending when they feel uncertain. Businesses delay hiring. These micro-decisions accumulate into macro outcomes. Government officials say talks continue and emphasize patient safety measures. They point to the complexity of balancing fair pay, fiscal responsibility, and long-term reform. Union representatives counter that without meaningful change, the system will continue to lurch from crisis to crisis. Analysts say both can be true, and that's the problem. This is why the phrase UK economy cracking is being used cautiously but increasingly. It's not about an immediate collapse, it's about stress fractures. Healthcare is one of the largest employers in the country. Its stability affects everything from local economies to national growth figures. When it strains, the economy feels it. There's historical context here. Previous periods of widespread industrial action often coincided with inflationary pressure, budget tightening, and political transition. The lesson from those moments is not that strikes cause economic decline, but that they often surface when underlying pressures have been ignored too long. As this situation develops, several outcomes are possible. A negotiated settlement could ease tensions and restore services quickly. Partial agreements could limit disruption but leave core issues unresolved. Or the standoff could harden, extending uncertainty. Each path carries different economic implications. What should viewers watch next? Pay attention to response time data, hospital admission backlogs, and government spending announcements. Watch labor market indicators in healthcare and adjacent sectors, and watch consumer confidence. These signals together will tell us whether this is a contained dispute or a sign of deeper trouble. For now, officials urge calm and responsible use of emergency services. Communities are adapting, and contingency plans are active. But the bigger conversation is unavoidable. A resilient economy depends on resilient public services. When those services strain, it's not just a workplace issue, it's an economic one. We'll continue to follow verified updates closely, separating fact from speculation and explaining what it means for households, workers, and businesses across the UK. Stay with us as this story evolves.